Hello, everyone. My name is Mohammad Al-Haddad. I'm a gastroenterologist here at Indiana University School of Medicine, Division of Gastroenterology and Hepatology. On behalf of all the co-authors, I would like to take a few minutes to introduce our research study that was recently accepted for publication in gastrointestinal endoscopy under the title Safety of Same-Day Discharge After Gastric Peroral Endoscopic Myotomy in Patients with Refractory Gastroparesis, an international multicenter study. This is a study of 482 patients from 11 tertiary and academic centers. 10 of those were from the US and one was from Europe. The purpose of the study was to examine existing practices in terms of same-day discharge versus admission of patients routinely after GPOEMs for observation, and also the utilization of upper GI x-rays to try to diagnose adverse events or to enforce a decision of sending a patient home after a GPOEM. So let me share with you some of the findings that we came across. Majority of the patients included in the study were admitted for overnight observation, and that's approximately 77% of the cohort. 23% of the patients went home the same day. And when we examined these two cohorts with some depth, we uncovered a few findings, including, for example, that patients who went home the same day were more likely to have a shorter GPOEM and a shorter anesthesia time. They were also more likely to have undergone suturing for the endoscopic mucosal incision that we created to perform the GPOEM in the stomach. And they were also more likely to have undergone something called a double myotomy, which is essentially cutting more than in one direction as we perform the cut in the pyloric sphincter muscle. And those observations led us to think about maybe what could have been done differently in those cases. It could have reflected, obviously, comfort level of the endoscopist in performing GPOEMs, maybe the volume of the procedures that these centers have done lends to more comfort discharging patients same day. But in regards to the endoscopic suturing for the mucosal incision, this is not the first study that would highlight this as a criterion for a secure closure. We've seen this in one other paper at least, and I personally do believe, and this is actually our practice here at Indiana University, that we suture these mucosal incisions rather than clipping them, given I think the more secure type of closure that this lends to. We found other interesting trends that you probably would want to know about. Most of the patients got admitted, and in the vast majority of those who were admitted, as in 97% of them, an upper GI x-ray was performed the next day before discharge. And this led us to think that probably is the reason behind the admission, since we know some of these upper GI x-rays are not routinely performed after hours, and patients would have to get these in the morning, which might have led to an additional night in the hospital. But we never found any differences in terms of either adverse events or readmission rates between the two groups, those who have undergone the upper GI x-rays or not. Although the majority have undergone upper GI x-rays, I don't think, except maybe in a handful of cases, there was any finding that changed the discharge plan in these patients. This, I think, is important as we continue to question the value of these studies. They do involve a higher cost, longer length of stay, and radiation exposure to the patient, and we don't believe that routine use of these x-rays is necessary at this point, at least based on our findings. A few more things to share with you about our study. The efficacy of GPOEM in refractory gastroparesis in our cohort is 56%, which is not very much different from what we have seen in other studies. Might be slightly lower than what we have actually seen, but we know that the pooled rate of success, according to the recent meta-analyses, is in the 60 to 61% range. So we're not that far from that. We also found that our overall adverse events and complication rates was lower than what has been previously reported, as in 4% adverse event rate, and also a 4% readmission rate within 15 days of the GPOEM. I think overall this speaks to the safety of the intervention and also probably to the refinement of the technique. As you know, this has been practiced for over 10 years now in multiple centers here in the US. So overall, I think that this was an important study to highlight a few things in regards to G-POEM. We are following some of the more recent literature on esophageal POEMs and on ESD, highlighting the safety of same-day discharge and the probably unnecessary need for observation in all patients as is currently practiced in the US, and also the lack of endorsement of performing routine upper GI x-rays with contrast, as those have not been shown to be beneficial to decision making or in any way changing maybe the conversation around how soon you can send a patient home after a G-POEM. Again, thank you so much for listening in and allowing us to share some of the findings from our recent paper to be soon published in Gastrointestinal Endoscopy.